Hello to all of you friends. I am Dr. Skerdi Faria, the founder of Keit Hospital. Today I want to speak openly, clearly and rigorously about the complications of aesthetic procedures and treatments in relation to how they are performed and managed. This topic isn't meant to cause fear, but to build real knowledge, because in medicine, what is not recognized and clearly defined cannot be controlled. In aesthetic medicine and surgery, every procedure is an intervention on a living body. The body reacts, adapts, resists, or welcomes change according to its own biological laws. For this reason, a complication is not an exception, but a real possibility that must always be taken into consideration. What makes the difference is not the promise that nothing will ever happen, but the existence of structured work with clear safety rules, careful evaluation, and a rapid response when something does not go as it should. To better understand this topic, complications can be observed in several main groups to make them more understandable. There are mild and predictable complications, complications related to the aesthetic result, functional complications, and rare but serious complications that require immediate intervention. Let's start with non-surgical procedures, the so-called aesthetic treatments, because it's precisely here that the misconception often arises that the risk is minimal and negligible. Injectable aesthetic treatments are real interventions on tissues, blood vessels, and nerve structures. The most common reactions after injections are swelling, redness, local sensitivity, and bruising. These are generally temporary effects that subside within a few days, but they must not be underestimated because how they are followed in the first few days affects healing and the result. There are cases where the swelling lasts longer than expected and the patient begins to feel that the area is not calming down. In these situations, it is fundamental to understand that one must not act in a hurry. No further procedures are added to an unstable area. One evaluates whether it is a normal tissue reaction or an excessive response. If necessary, we proceed with targeted interventions and procedures to reduce inflammation and with monitoring until complete stabilization. Another concrete situation in injectable treatments is the appearance of nodules or hardening of the treated area. Sometimes they are part of the initial phase of tissue adaptation, other times they are linked to an uneven distribution of the injected substance. This requires a careful evaluation and, above all, time. Repeated and unnecessary procedures often make the situation worse. Then come the complications related to the aesthetic result. A frequent problem is persistent asymmetry. It is important to remember that asymmetry is present in all individuals, but after a treatment it can become more evident, especially if the expectation is to achieve a perfectly symmetrical face. In these cases, the professional approach consists of waiting for the tissues to stabilize and avoiding hasty correction decisions, because premature corrections often lead to a continuous cycle of procedures. There is also another aesthetic complication that can manifest later: the migration of the injected substance, the classic filler, from the point where it was placed. This can happen for several reasons and lead to changes in shape or volume in unwanted areas. At this point, the evaluation must be clear-headed and rational, distinguishing what is temporary, what is part of the adaptation process, and what requires a targeted intervention. At this point, it is necessary to speak clearly about the rare but serious complications in injectable treatments. One of the most significant risks is unwanted interference with blood circulation in the tissues. Warning signs include intense pain, a sudden change in skin color, whitening, darkening of the area, and sometimes pain that is disproportionate to what is normally expected. The classic risk of tissue death, which is necrosis. In these situations, immediate medical intervention is essential because the time factor is decisive. Let's move on now to aesthetic surgery, where complications can be understood more clearly if they are ordered based on when they appear, rather than based on the fear they arouse. This classification is not intended to dramatize, but to help the patient and the professional speak the same language and understand what is happening at each stage of healing. First, we find early post-operative complications, which manifest in the hours or first days after the procedure. This category includes blood accumulation in the operated area, a sudden increase in swelling, pain that worsens instead of decreasing, and changes in skin color. These complications are directly linked to the surgical act and the body's initial response. They require an immediate evaluation, because the earlier the intervention, the fewer the consequences will be on healing and the final result. At this stage, passive waiting represents one of the most serious mistakes. In the same period, as a distinctive subcategory, early serious complications should also be considered, which are rarer but require a rapid response and structured management. This category includes internal bleeding or a significant accumulation of blood that rapidly increases pressure in the operated area and can compromise blood supply to the tissues, as well as circulation disorders that prevent normal skin healing. In rare cases, surgery can also be associated with systemic complications such as the formation of thrombi in deep veins and the risk of pulmonary thromboembolism. For this reason, the assessment of risk factors and compliance with post-operative instructions are fundamental elements of safety. Subsequently, usually after a few days, although very rare, infectious complications can also appear. These are not always evident at the beginning. They often start with mild signs that may seem insignificant: progressive redness, increase in local temperature, pain that does not subside, secretions from the wound, or fever. These complications are related to the body's response and the balance between tissues and invading microorganisms. What matters is not just the treatment, but early recognition and constant monitoring, because a hospital infection identified in time has minimal consequences, while a neglected infection can compromise the entire healing process. This phase also includes deep infections associated with fever, worsening pain, and secretions from the wound. During the first few weeks and beyond, sensitivity complications related to nerves may manifest. After the operation, the treated area may be numb, present tingling, or an altered sensitivity. In most cases, these changes are temporary and gradually improve, but they require follow-up to assess if the evolution is favorable. For the patient, these sensations can be a source of concern even when they do not represent a medical risk. And that is why communication and explanation are an integral part of complication management. In the same time interval, especially when the swelling begins to reduce and the patient resumes daily routine, functional complications also become more evident, which are among the most important from a medical point of view. This category includes, for example, breathing difficulties after nose surgery, limitation of movement after interventions in certain areas, or the sensation of abnormal functioning of a part of the body. These complications can never be justified by the aesthetic result. When function is compromised, we are faced with a serious problem that requires an in-depth evaluation and, in some cases, a corrective intervention. Subsequently, tissue healing complications appear, which become more evident weeks or months after the operation. In this phase, we see thickened, widened, or raised scars, slow healing, tissue stiffness, and a persistent feeling of tension. These are the usual hypertrophic scars or keloids. These complications aren't always the result of surgical technique, but often depend on genetics, tissue tension, and the individual's way of healing. In this phase, the biggest mistake is rushing to intervene. The tissues need time to stabilize. Any premature intervention can make the situation worse. Finally, when the swelling has gone down, tissues have stabilized, and the result is clearer, aesthetic complications related to the final look are assessed. This category includes new asymmetries, irregular contours, or changes in shape that don't match expectations or the overall harmony. It's essential to distinguish between what's just a healing phase and what constitutes a permanent problem. Not every imperfection in the first few weeks is a complication. It's often part of the normal recovery process. Only after stabilization is it possible to assess whether corrective surgery is necessary. In conclusion, complications aren't avoided by ignoring them, but by recognizing them promptly, managing them responsibly, and putting safety above all else. Responsible medicine and aesthetic surgery are those that don't promise guaranteed perfection, but act with transparency and long-term care for the patient. Thanks again for listening.